What do you think your patients are expecting from physical therapy? Are they expecting passive physical therapy or are they expecting active physical therapy? Here's what we're talking about. So we just did an evaluation on a patient who had previously seen physical therapists, and she was expecting passive physical therapy. So what did she expect?
She expected modalities, and that was about it.
Okay. And what were the outcomes that she was expecting?
Decreased pain.
Okay. So when we were asking her questions about increase in strength, what it feels like strength-wise, stability-wise, did she have a concept of what we were talking about?
No, not unless you verbally cued her beforehand to pay attention to it.
Okay. So when we're working with patients, the entire time we are evaluating them and we need to get feedback from them as to strength, range of motion, stability, that type of thing. So when we're asking them about changes in strength that happen immediately, they are kind of clued out if they've seen physical therapy before, because they're used to passive physical therapy where somebody is doing something to them to manipulate their symptoms, which is what we should not be doing with our patients.